247 million people suffered from malaria in 2021. That's an increase of 2 million cases from 2020, according to the WHO's World Malaria Report 2022, released in December. 619,000 people lost their lives to the mosquito-borne disease, and most of them were children under 5 in sub-Saharan Africa. For more on the fight against malaria, I spoke with Dr. Corine Karema, Interim Chief Executive Officer of the RBM Partnership. Take a look.
The fights against malaria remain precarious, especially in sub-Saharan Africa, where the malaria burden remains very high. We are seeing more insecticide and drug resistance. There is, of course, the COVID impact that has affected and disrupted the malaria services. And there is also limited funding that is posing another challenge to the disease control efforts. So in terms of the numbers, when we look at the WHO World Malaria Report of 2021, so there were 214 million malaria cases and 627,000 lives were lost to malaria, which is an increase of 69 deaths compared to the year before.
Recently, there was results of a clinical trial with the Oxford University Research in partnership with researchers in Burkina Faso that found that a vaccine against malaria was efficacious for at least 80%. What is your reaction when you see this kind of research in terms of the future impact of malaria control?
We are grateful that we are seeing new and innovation tools like the vaccine. We are seeing many vaccine candidates for malaria. We are also seeing a new generation of mosquito nets that are being developed and showing that they can protect and prevent malaria in area where we have insecticide resistance. I see we have a lot in terms of innovation in the pipeline. So this is really great. But we also need to use well the resources that are available. So we have seen there are many countries now, we have 25 countries that are eliminating malaria. They've used the existing tools. We have hope. We are seeing their countries, and with the innovation that we have in pipeline, as well as the gene drive, the mosquito genetically modified, those are really innovation that are also going to be added to the existing tools and combined together can help us to reach our targets to end malaria.
When will we see the end of malaria?
It's not acceptable to die from malaria today because this is a preventable and treatable disease. So for us to stay ahead of the challenges and ultimately end malaria, we need, first of all, to use correctly the available resources, use data to target the hard to reach population, and also tailor our intervention based on the malaria transmissions, and then funding also, more funding for us. And those are the most three important, in addition to the strong health system to help us to end malaria for good.
And finally, what are some current priorities for the RBM Partnership?
The RBM Partnership will continue to work to keep malaria high on global health and political agenda, particularly to mobilize more resources, more partners, and galvanize commitment from government and the private sector, and by promoting a multilateral response to malaria elimination. So we will continue to work with governments and partners across the world to mobilize resources, and this is invested to maximum effect by, first of all, facilitating sharing of quality data to drive better decision making, transparency, as well as accountability. Second, to support countries, of course, to optimize the quality and effectiveness of their malaria program. And then the last one is to support the deployment and scale up of new malaria tools, all the innovation and approaches.
And thank you, Linord, for that wonderful health segment. Be sure to watch Linord Moudou's Health Reports every Tuesday right here on Africa 54.